Governor Greg Abbott announced that the state will get millions of rapid coronavirus tests that could yield results in 15 minutes. Battered industries like the airlines and restaurants are looking at rapid testing. In Austin, 15,000 fans attended the Longhorns' home opener against UT El Paso. They were required to test the day before. Dr. Michael Chang, an infectious disease specialist at UTHealth, describes how testing will figure in our daily lives and help restart a robust economy.
The issue is testing capacity overall. So one of the kind of foundational principles of good infection prevention and controlling spread of disease is to be able to test quickly and often to identify people who are infected and get them isolated or quarantined, get them isolated quickly and out of kind of like the community as quickly as possible so that they can minimize further spread from those people. But, as you are, I'm sure, well aware, we've had major issues with testing capacity and turnaround time of the existing tests. So the problem becomes, how are you using the tests? And so as you can see, I think President Trump's experience is a good example of that. Just using tests or relying only on tests to screen without kind of the other measures is not necessarily going to be foolproof. It's not going to be 100%. And any test is only a snapshot. So, it's your result that day. So right. Even if you had 100%, if you had 100% accurate test, which no test is, right? But let's just assume you had 100% accurate test, it's just that day. So let's say you only test every other day or every third day, then let's say you're negative today, and this is assuming 100% accurate test. You're negative today, but then you get exposed tomorrow, right? But you don't test for 3 days. There's this window time where you're positive and you're not testing, right? So because the test is only a snapshot of what any situation is at a given time, unless you're testing daily,
right.
Then, it's just really going to be difficult to use it as a screening technique. Now, does it help? So I'm not saying it's useless, right? So for like the football game at UT, like, what if you pick up some patients, what if you do identify some individuals who are positive and didn't know they were positive and they're either asymptomatic or pre-symptomatic, then that's great. That's awesome. You've identified some people who shouldn't be out, and now you can isolate them and you can do contact tracing for those people. And so it is, if you can have frequent testing, it is helpful, but you cannot rely on frequent testing as your only screening methodology. So even if you do test everyone, again, I think, the president's experience is very good. They are saying in the White House that everybody's tested every day, right? But you can see that he ended up with a positive test, and multiple people ended up with positive test results. So you still need the other measures in place. You need the masks, you need the physical distancing, you need the hygiene, because the test is not 100%. Can it help open things up? Absolutely. So I do think it can do that, though, right? Because if we can test frequently enough, but people still kind of take some physical, like personal responsibility for being symptomatic and following the physical distancing, then yes, having a negative test and wearing a mask and physical distancing, that is reassuring. And I think that can allow us to open up some more activities. But at the same time, you can't rely on the testing alone. Interestingly enough, I've been using the sports bubbles as kind of a positive example where, the NBA sports bubble, they were testing daily. They had frequent, symptom checks, to go with the testing. And so the sports bubbles are kind of an interesting example of the possibility of having frequent testing be useful. But the NBA sports bubbles, they did daily testing, for like all the players and staff. But they also continued to have physical distancing, et cetera. And then now you can see MLB and NFL, MLB kind of had a disastrous opening, but since they've also kind of started a daily testing regimen, but in coordination with everything else. So so those would probably be the best examples now where people are testing very frequently. But again, very rarely are tests being done in isolation, like as the only answer.
Right, as part of the mix.
Right.
Chang is amazed by how quickly vaccines are being developed. Producing tests and potential vaccines generally takes years, but now science has accomplished this in 9 to 10 months. There are 7 vaccine candidates. 3 are now in big U.S. trials. They're being tested on 30,000 to 40,000 people. Thousands of people sounds like a lot, but, Chang cautions, not when they're intended for hundreds of millions.
The initial data that's come out is, yes, all the candidates do seem to generate an immune response. And in the few, bits of information that we have heard, the vaccines seem to be well tolerated. But the reason I mentioned like 30,000 versus, 100 million is even though 30,000 people sounds like a lot, if you have a 1 in a million side effect, and you've only vaccinated 30,000 people, you may not see it, right? So it may not be until you vaccinate 100 million people that there's a potential to detect some potential side effects of the vaccination. So I think, I think the vaccine is going to be super important to develop. I think it's a necessary piece of controlling this pandemic. But at the same time, a lot of questions kind of remain about how well these vaccines are going to work. And whether or not really, the American public is going to be willing to accept it. I think there's a lot of concerns about safety, and not necessarily, I don't necessarily think a lot of healthcare providers have questions about safety. I think we are waiting to see the data, but I think a lot of the American public will have concerns about the safety of these vaccines, and I think it's reasonable to be skeptical until the companies and the vaccine trials can be transparent about their data. And then and one of the other difficulties that's happened in the last few weeks is you're seeing kind of data from different phases of the trials, right? So classically, drugs and vaccines move through like phase 1, 2, and 3, but what a lot of these vaccine trials are doing they're doing the phase 1, 2, and 3 trials at the same time. So, so you may be getting like some information from the phase 2 part, you're getting some information from the phase 1 part for others, and so kind of the messaging around the data about like how well the antibody response was or the safety profile, like it can be a little bit mixed up. So I think that's been making it difficult for everyone to kind of judge how the vaccine trials are going.
Is there a time frame that you epidemiologists kind of are looking at?
My
$64,000 question.
Yeah. I think spring will have a lot of data, hopefully from these trials. And I think at that point, once we have data available and once it's been vetted, I think, I would suspect spring of 2021 is when we get enough information where people will be able to judge how well the vaccine works. I certainly think that I think before New Year's is very unlikely. And I think more like, spring of next year is more realistic. The other thing I want to emphasize is, the disparities between racial and ethnic minorities for Latinx and African American and Black Americans. The COVID-19 pandemic seems to have affected those demographic groups quite a bit more than other demographics in the United States. And so, one of the issues with the vaccine trials is, are we sure we're enrolling the right people as well? And so I think one of the things that will need to come out as far as data and results are concerned is, what was the makeup of the volunteer population? Is it reflective of the United States? Is it reflective of the burden of the disease, right? So I think that's going to be an important issue to look at when more data from the vaccine trials are available.
For the People's News, this is John Moeller reporting.